gentlemen, I'm so thrilled and excited to have you on a very important episode, which is really impacting many people around the globe. And it's an epidemic. We're going to talk about diabetes. And I know many of our viewers who are watching now have either diabetes themselves or their relatives, or they know someone who knows suffering through diabetes and its complications. That's why we have invited one of the top global leaders who is actually a proponent of treating as well as avoiding the complications of diabetes earlier, also doing amazing conferences around the globe, including diabetes and Ramadan and other types of fasting. With that, welcoming Professor Dr. Mehmet Akif Büyükbeşe. Welcome to Global Health. How are you today?
I'm great. How are you?
Thank you so much. I know how busy you are, and I really appreciate your valuable time in this very busy schedule. Our viewers were so excited about your initial episode when they heard about who Mehmet Akif Büyükbeşe is. There was a huge interest on doing some more episodes. And now, especially, there are many people who wants to learn more about diabetes from you. And starting with, from your expertise and perspective, what is diabetes and what are the types of diabetes?
Okay. Thank you for inviting me once again. I would like to say greetings to all your team members at Global Health, AFROTURK. Well, diabetes itself is a chronic disease, actually, where most of the time blood sugar is high. So if you are fasting, let's say 8 hours, not eating throughout the night, early in the morning, your blood sugar is over 126 milligrams per deciliter. It should be, if divided to 18, then the millimole per liter will be obtained, because some of the machines will measure not only milligrams per deciliter, but millimole. So I do not want to be misunderstood by that way. But the other one, which is more important, is the postprandial, what we say after meal blood sugar, which is over 200 milligrams per deciliter. So what is normal for blood sugar then in a normal body? Well, your fasting should not go beyond 100 milligrams per deciliter when fasting. And even if you eat baklava, for example, I want to give that sample very much, then your blood sugar shouldn't be over 140. So it has to be between. So what is the low blood sugar? How low my blood sugar be? Up to 70 milligrams per deciliter, to understanding, as you know, medicine is ever changing stuff.
So 140 and 70 are major cutoffs our viewers need to know for sure.
Yeah.
Okay.
You summarized perfectly. Yeah. Your blood sugar, whatever you eat, however you fast or something like that, let's say you fast for about 16 hours, it shouldn't be go less than 70. And after eating, it shouldn't go, whatever you eat, more than 140. So this is the normal range.
I see. And in terms of the types of diabetes, many patients you treat, either they have type 1 or type 2. Many patients are asking, which type of diabetes do I have, and what are if I have type 1, will I live longer? There are many different questions people are asking. So just
Exactly, after 1921, yes, you will live longer. And some people live really longer than the average population today if they learn their diabetes.
Wow.
If they become friendly with their diabetes, and if they also care their diabetes, not only their healthcare professionals, then they live longer. We have shown that.
So it has to be a mutual relationship, not one-sided. If you take care of diabetes takes care of you and you have a longer life. Is that correct? Yeah.
That's correct. Absolutely. This is the key element, actually, for any type of diabetes, but especially for type 1 diabetes. And today, type 1 diabetes, we do not like to actually label like type 1 or type 2, but sometimes it is easy to give messages.
Sure.
Or, it's sometimes like a name, so that, let's say you are in a role to understand what's going on, it may make easier. But today, we cannot still say that all type 1 diabetes people should have that schedule, that, formula, or type 2s, because each people with diabetes have a specific and unique treatment modality, which is common in medical understanding, modern medicine understanding today. And yeah, the problem with type 1 diabetes is your pancreas, which is supposed to produce insulin regularly.
I see.
Yeah, it doesn't do that because of lack of insulin. So you have 10 days to meet with insulin and become friendly with insulin in order to save your life. That's important. Otherwise, complications may arise. This is type 1 diabetes, it, in short,
Sure.
description of what's going on.
You're just not producing the insulin, and that's why you need to find a way to manage it urgently.
Yeah, and physiologically, there is only single hormone in our body. It's insulin today, what we know, which diminishes your blood sugar, reduces your blood sugar. However, we have bunch of other, glucose sugar raising hormones,
I see.
glucagon, adrenaline, noradrenaline, thyroid hormones, even steroids. For many reasons, people are having steroids, even if they have diabetes or not. Later we can talk about it. But with type 2 diabetes, actually, your pancreas actually produces more than enough insulin in order to get rid of the burden of the blood sugar in your bloodstream. However, they cannot overcome. We call it insulin resistance. For the audience, in order to give the message, for example, let's say one of the student is, very lazy. Whatever teacher you provide as a private lesson, for example, still the math score is not satisfying. So there is insulin, more than enough insulin, but there is no, accomplishment to get rid of the high blood sugar. So it's called insulin resistance. So most of the time, type 2 diabetes is the issue of insulin resistance. And 90% of the time all over the world, it is type 2 diabetes rather than type 1 diabetes. The other one, the third one, is diabetes in pregnancy or pregnancy-induced diabetes. So I don't want to go in details what's going on, but that's important because if you have diabetes during pregnancy, it gives lots of message. So
Yes.
women are lucky than men in that manner because they get pregnant. If their pregnancy is with high blood sugar, it may tell us the likelihood of developing diabetes later in life
Amazing.
is at least 40% increased.
Wow.
So we gentlemen do not have such an, early
You're right.
risky elements in order to
I just received a message through the 905529070606 number. One of our viewers from Nigeria, Daniel, provides greetings. He's very excited about your statements, and he is very curious. How frequently should Daniel follow his blood sugar?
Okay. So, well, uh, actually, we have to know his blood glucose readings because, there are many ways today to understand how diabetes is, providing any clinical picture in that body. Because diabetes is not a standstill, disease. It progresses. So I say diabetes itself has seasons. If it is winter, then something is going wrong, or you're not that much friendly with your diabetes.
I see.
Let's say today, rather than the fasting and postprandial after meal sugar levels, we have hemoglobin A1C, which summarizes the 3-monthly average of your blood sugar. That gives an idea. Sometimes it's a tool for the diagnosis of diabetes, and sometimes it is how your diabetes is going on. But the third thing is that the time in range where your blood sugar is normal, but you are checking your blood sugar in the day, a specific area there actually you know that your blood sugar is normal. But the body, we have a metabolic memory. I mean, if you do something wrong, but we do not check it, it's already recorded over there. And there is a, unfortunately, consequence for that. So let's say, well, my blood sugar was normal. Why do I have that much tingling? Why do I have, which is called in medicine, we say neuropathy, for example, is actually because of that. So for critical people, rather than having blood glucose measurement at home, what we call, glucometer tools of any kind, we also have continuous glucose monitoring systems. It is throughout the day, you are going to have what's going on. Those people are level people, level diabetes, or they have critical pregnancy with diabetes in order to save both of the lives, not only the fetus, but also the mother as well. Or the patient is adolescent. So, this type of people are very much prone to that. So when I say at least 2 times as the beginning, one fasting, one postprandial. The postprandial should slide. We call it sliding scale blood glucose measurement. That means, for example, Monday after breakfast, a Tuesday after lunch, Wednesday after dinner, Thursday before bedtime.
Okay.
But whenever you feel, something going wrong, it doesn't matter. You feel extreme tired, but you cannot explain that. You feel Thursday. You start going to restroom, not in a regular manner as a comparison to yesterday, for example. Something is going wrong with your body. Please check your blood sugar, I say. You are, angry, for example. There's no reason, but you feel angry. You start trembling or something. It may not always be that your blood sugar is going high, maybe low. And sometimes low and high may have some similar symptoms. So in order to understand what is going on, you have to have a blood glucose meter by chemistry. I mean, a kind of a mini lab at home. That's very important to deal with your blood sugar, I can say.
Amazing. This is very, very insightful. Thank you for that. And in terms of the complications, if we can talk about the complications of diabetes, what are, I mean, some people say, I don't care, I have diabetes, but I know many people who don't have diabetes, they die before me. So, what's your answer to them? What will be the quality of life who is not taking care of their diabetes? What are the complications expecting them?
Yeah, there are early complications and late complications. Number one, most of the diabetes are type 2 diabetes. And today, when you walk into the intensive care units, let's say it's a cardiac care unit, who are suffering and are still alive after myocardial infarction, like say heart attack, 1/3 of them are actually having diabetes. And of those who have diabetes, 1/3 are not aware of their diabetes. They know it, but too late.
I see.
Because we not only take into consideration of the blood sugar measurement, we also take into consideration of saving the organs.
That's true.
Because blood sugar is, carried through the bloodstream through everywhere. And today we call diabetes is an endothelial disease. Endothelium is the layer of any vasculature, artery or the vein. It doesn't matter, but most of the time we are focusing on artery because if there's something wrong with the artery. If that artery is in the heart, then the heart attack may ensue, or it may be in the brain, then the cerebrovascular disease, stroke may arise. And if it's in the kidney, then the kidney failure hemodialysis program will start. And today we know that most of the people in the hemodialysis unit are suffering from uncontrolled type 2 diabetes in their past. So in 1997, look at that. It is almost a quarter century ago. American Diabetes Association stated that diabetes itself is a silent killer. So you have diabetes, but you are not Thursday. You have diabetes, but you are not losing weight. You have diabetes, but you are not going that much often to restroom, toilet. So these are the common manifestations, but the most common manifestation is being tired. This is very subjective. Many people are tired, even if they are not a marathon runner today. psychologically you may feel. So that's why it's called. Number two, after a certain period of time, especially if your blood sugar is going up and down with the spikes, so it also will lead to unawareness of hypoglycemia later in life. And unawareness of hypoglycemia means that even if you are with 30 milligrams, which is, at the critical level, but, you're not aware, because if you're aware, then trembling will happen, hunger will happen, thirsty will happen, many things will happen, but it doesn't happen. So this is very critical. So you have to have, I can say blood sugar measurement at home is a must.
I see. So basically, one of our other viewers is asking, Sir, I have diabetes, Dr. Büyükbeşe, but what should I do my child not to have diabetes, develop, and also start having complications? What should my children do to avoid diabetes and its complications?
Yeah. Even in the United States, when you put the diagnosis of diabetes for type 2, of course, I'm talking about 90% of the portion of the diabetes burden all over the world, you are at least 5 years late. Tremendous efforts, millions of dollars are invested on this issue, but we have some clues today. Many people are working in order to understand the risky people, even when they are in their mother's in their mother's womb, in order to understand what they call anthropometric, measurements, to understand to ask the mother whether you want to have a baby like at age 40 who is suffering from type 2 diabetes. But it has been shown that if the mother carrying the baby inside gives a birth more than 40 kilograms, then this is a risk for mother to develop diabetes later in life. But if the fetus, the infant born, is less than the usual weight, like say less than 2.5 kilograms, then the risk starts for the fetus for his or her later in life to develop diabetes. So more weight is risky for mother, less weight is risk for the infant to develop diabetes later in life. This is number one. But there's some other things. Of course, obesity. Considering Africa malnutrition, I mean, you may be not obese, but you may have the risk of diabetes. As chemistry, let's say your blood sugar as fasting is not 126, but not within normal limits. I mean, not less than 100, but in between, like say 100 and 126 in between there. So this is impaired fasting glucose called pre-diabetes. Not yet to put diagnosis of diabetes, but it may be reversible, especially for type 2 diabetes. I'm talking about again, the most, fraction of the diabetes. This is number one. Number two, sometimes your fasting is okay, but your postprandial is over 140, but not yet jumping over 200. So it's not yet to put diagnosis of diabetes again postprandially after meal sugar I'm talking about, but between 140, let's say 175, but not over 200. So when it is between 140 and 200 after meal sugar is a sign to develop diabetes later in life. What would they do? Well, they eat well. What is eating well is a good question. Sometimes you cannot solve it, but a dietitian program, sometimes group sessions may help because you may be, that malnourished or you may be obese, but both of them should be treated. You have to convince yourself, but nobody comes to your kitchen and, deliver you have to eat. But if you're keen on learning, you can diminish your risk. Today, with the lifestyle modification, including wise or smart nutrition, plus correct exercise, which we call isometric exercise, including cycling, jogging, walking, running, and even dancing. Because, exercise is a terrible thing in a busy traffic of a daily life. Nobody is that much keen on doing exercise, and everybody is, suffering from lack of time or something. But if you make it enjoyable, then of course, exercise becomes not that much matter. One other thing in the biochemistry, of course, we can read. You may have high cholesterol levels. Your blood sugar was within normal limits. This is also problematic. What I mean by cholesterol is bad cholesterol and good cholesterol we have. Like, say, LDL cholesterol is a bad cholesterol and HDL is a good cholesterol. If your good cholesterol is low or bad cholesterol is high, or both of them. One another cholesterol is triglyceride. It is also a risk factor for the development of diabetes. So that means if you get rid of high cholesterol, you can also decrease your risk of development of diabetes.
I see. And in terms of the major complications, then you have less chance of having these complications, like losing your leg, becoming blind, losing your kidney, or developing neuropathy, or many other issues, ischemia. I want to thank you. I think this was an amazing diabetes episode. Can we finalize your messages in terms of our viewers, to our more than 1 billion viewers? What are your final messages about diabetes for them, Dr. Büyükbeşe?
Yeah, diabetes is also common in Africa, not only, the MENA region. So it's very easy today. You can walk into any pharmacy office and just single drop in 5 seconds, you would have your risk. I mean, if you're postprandial sugar, do your best as eating and see your body's metabolic capacity. If it is over 140, please run into your family medicine physician. Or if it is already higher than 200, well, please do that immediately. That's an easy way, cheap, and very diagnostic.
Amazing.
I can say.
Amazing.
And if you have no option to go anywhere, but your first degree relatives are suffering from diabetes, well, you are under the risk of diabetes. Please walk into your GP's office.
Professor Dr. Mehmet Akif Büyükbeşe, it was an amazing episode. I learned a lot myself. I'm sure our viewers also, I receive lots of messages now. They are continuing and asking for more episodes. So I want to thank you again. I will invite you again, probably again, something about diabetes and maybe combining it with Ramadan. If you accept our invitation, I would be grateful. Thank you very much. I really appreciate your leadership. Thank you.
I admire your being so much humble. I thank you.
Thank you. Ladies and gentlemen, this was a specific episode only for diabetes, which has become a huge epidemic around the globe, and especially with a focus on how to treat, how to prevent, and how to monitor, as well as the impact in Africa. There will be more episodes coming, especially another episode about diabetes and Ramadan. So if you're fasting, do not miss our next episode. This is Dr. Yavuz Selim Sılay, physician, entrepreneur, and venture architect, and the founder of AFROTURK TV, with our amazing team here in our studios, Betül, as well as Recep. I want to thank my amazing team for their leadership. Take care and all the best. Bye.